Testing visual acuity is the most important eye exam of them all, and in the next few minutes I will teach you how to perform it properly. I will teach you which of the particular options of this exam is usable for your particular situation, and I will guide you step by step on how to perform this exam. So let's begin. I'm Dr. Tinio. I'm an ophthalmologist, glaucoma specialist, the training officer of the Medical Center Manila, and the training officer of Emilio Aguinaldo School of Medicine. Visual acuity is the ability of the eye to see fine details, and it's the most accepted way to measure your vision. This should be done as part of all exams, no exceptions. That's right, no exceptions. It simultaneously checks the corneal clarity, lens clarity, vitreous clarity, the macular function, and optic nerve function. This is very useful for checking refractive errors and general eye health. Also, when monitoring the course of an eye disease and the effectiveness of its treatment. Moreover, it is used as a standard for driving, employment, and even disability. I would like to remind you, subscribe and ring the bell. Since it is so important, there are a lot of options available to check the visual acuity, from the modern LED screens, chart projectors, to different types of cardboard posters. But let us start with the most basic. In a clinic setting, we use a distance vision chart and a near chart. But outside of a clinical setting, we can use a near chart. But the principles will usually be the same. Here are two of the most common charts available, the Snellen chart and the LogMAR chart. You can see they're visually very different from each other. The Snellen chart is what you will encounter in most clinics, but it is not the most accurate. Later on, I'll tell you which one is the most accurate. Put the chart on a well-lighted wall and measure 6 meters or 20 feet and mark the floor so your patient will know where to stand. Some clinics are just not that large. So in that case, we put a mirror halfway to the chart, or 10 feet or 3 meters, which roughly translates to about double the amount because we bounce the light off the mirror. Please remember to subscribe and ring the bell. There are 3 stages to this test. The first is done without glasses or contact lenses. It's called uncorrected or SC. The second is done while wearing glasses or contact lenses and is called corrected or CC. The third is done through a pinhole and is noted as PH. Let's start with the first. The test is done one eye at a time, so we ask your patient to cover one eye with an occluder. There are several important points in this step. The eye should be well covered, as some patients will be tempted to peek with the covered eye. Don't use hands to cover the eye, as we can peek through fingers, just as what we usually do when we watch horror movies. If you really have to because you lost your occluder, you can get away with using your palm. You can also use a thick card or notebook if you really have to. Please do not put pressure on the covered eye to avoid changing its shape. It is best to use an occluder to cover the eye, and as you can see here, you have a lot of choices on which ones to use for the eye. All of them will just be as when ready. Ask the patient to read from the largest to the smallest letters that they can. You can glance back and forth from the chart to your patient to monitor their progress and check if they are still covering one eye. Some patients will try to peek with the other eye if they start having problems with the eye being tested. Depending on which is the smallest line your patient can read, write the corresponding number like 2020 or 660. The number at the top means that your patient can see the letter from 20 feet or 6 meters, while the number below means that that person with a normal vision can see that same thing at 200 feet or 60 meters. If your patient can only read some of the letters, not all of the letters in a single line, for that line to be counted, you can only make a mistake of 2 letters. Then you can write it down, example, 2030 minus 2, or plus 2. So what happens if the patient cannot see even the largest letter? You ask your patient to walk towards the chart until they can see the largest letter. The distance where they can see the largest letter should be written down. And if they cannot see the largest letter even at 1 meter, then let's test their ability to see fingers. First, ask them to count the fingers. Ask them if they can see hand movements by waving your hand in front of their eyes. And if they cannot even see your hand, use a flashlight and ask them from which direction the light is coming from. If they can't tell where the light is coming from, ask them if they can see light. And if they could not even see the light of your flashlight, put the flashlight against their closed eyelids. If their retina is intact, they should be able to see some light bouncing off from the blood vessels. This is called no light perception. Be careful when you diagnose your patient with no light perception, because in that case, their blindness is irreversible. Now, for the second part, let's test by asking the patient to wear glasses if they already have those. Otherwise, skip to the next part. For the third part, if the visual acuity is less than 20/30, then you should do a pinhole test. Pinholes act as universal glasses, and an improvement in vision when using them indicates a likely refractive error. Spectacles or eyeglasses should improve your patient's vision. And when your patients cannot read letters or have difficulty communicating, then you can use either the Tumbling E or the Landolt test. They're very easy to understand for kids or adults who don't know how to read or have a very hard time communicating. The best chart to use for visual acuity testing is the LogMAR chart. The LogMAR chart is the most accurate among all the charts. However, its notations are a little confusing. For example, normal vision is noted as 0. Good vision is noted as negative. And bad vision is noted as positive. It's a little confusing, but it's designed to be the most accurate among all the exams. The best way to master this exam is to practice, practice, and practice some more. Keep performing this exam and check back on this video every now and then to fine-tune your skills. Soon, you'll be doing this exam very fast and in a very reliable fashion. Please remember to subscribe